Very good morning to all of you. Can we please request all of you to settle down? People at the registration desk, please come in. We are starting the session and we can continue with the registration during the tea break. I think it's the last day. People are still joining us, so request all of you to kindly come in front. Okay. So again, a very good morning and welcome to the third day of the conference, Delivering for Nutrition, Connecting the Dots Across Food Systems. We are starting today with a plenary session which actually talks about connecting the dots and how evidence is taken to the policymakers and how it is finally converted into actionable programs and policies. So without any further ado, let me introduce the co-chairs of this session. Our first co-chair is Aarti Ahuja, who has held various senior level positions in the Government of India over a career spanning 34 years. She has steered implementation as well as policy making in different positions. I would really like to emphasize on the point that I'm going to say next, that many system reforms initiated by her, especially in health, nutrition, and issues relating to women, have been nationally and internationally recognized. She holds a Master's in Public Policy from the Princeton, Master's in Public Health from Harvard, Master's in Economics from Chandigarh University, and LLB from Delhi University. Aarti is also on the advisory committee of the Global Nutrition Report, and she is also on the advisory committee of Global Climate, Gender, and Nutrition. She is an honorary senior fellow at the Global Institute of Health, University of London. Welcome, Aarti ji. Please, can I have you on the stage? Can I have a big round of applause for Aarti Ahuja? Our next co-chair for this session is Purnima Menon. Since I've already introduced her on the first day, I will not do that again. But please have a big round of applause for Purnima as well. Over to both of you.
Thank you, Isha. I must say I had very different smiles coming at me this morning from those people who were on the dance floor with me last night, so after the party. Thank you all for being here again. Today, it is incredible to still see a full room on day 3 of the conference. I think it speaks to the value that we place in connecting the dots. This morning's session is particularly important because it really is about connecting dots to achieve change. What we have on the panel is an incredible set of individuals, each of whom has had experiences that really connect the dots between research, policy, and action. Each of them will speak to us about how they have really tried to bring things together and what they've learned about the art, the craft, and the science and science as well of moving from evidence to action, but also of building better evidence through the connections that we build between people who are trying to develop policies and programs. Why is this type of a session so important for a conference that is predominantly about research and evidence as it's framed? It's because wicked problems really take all of us to act together. And they take all of us to act together because to really change something, you need to first acknowledge that the problem exists. You need to understand the problem and the reasons why that problem exists. So that's really crucial, and that's a role that researchers can really play in this world. But people who need to act on the problem actually need to acknowledge and accept that there is a problem. They need to really think about what solutions they have to offer for the many different drivers of that problem. And then those solutions need to be brought into implementation frameworks, they need to be financed, they need to themselves be monitored and evaluated. And honestly, there is no way for us to work on these wicked problems over the many, many years that they take to solve without being together. We have seen many examples where problems have not been acted upon simply because they have not been accepted as problems. We have seen many situations where the deepest drivers of some of the problems, the structural inequalities, as we saw so eloquently in Sainath's talk on day one, have not been acted upon because we have somehow not accepted that structural inequalities still lie at the heart of many of the problems we see. And if we don't accept those very things with evidence, it's going to be just that much harder to walk the walk towards effective policies and actions. So I'm really thrilled that on our morning panel today, we'll try to walk that continuum of how problems get solved and why it is so important in that solving of problems that we connect the dots between researchers, policymakers, and implementers, and financiers. So, with those opening remarks, let me hand over to Aarti to say a few words, and then I will introduce our panelists after that.
Thank you, Purnima, and thank you, IFPRI. I've been a policymaker and implementer all my life, and so are a whole lot of people here. What I really loved about this was the different strands of thought, of evidence that came out, and the fact there's a good mix of people exchanging ideas, learning from each other. You mentioned the word walk. When we translate to policy, how do we really walk the talk, right? So there has been a whole lot of information. Now, on the last day, this is the time to pull the threads, to put it all together and understand from that perspective, what is it that we collectively need to do? And believe me, whatever I've talked to most of the people in this room, there's an amazing sense of solidarity. There's an amazing sense of wanting to do something. These are all nutrition champions here. And I think if we put our heads together, there's nothing that cannot be done. But it cannot be done just by thinking about it. How do we really translate all this research, all these ideas into action? Otherwise, it's just research in a silo. It's just one of the dots there. How do you actually get to the policymaker? As a policymaker, I've understood one thing, Purnima, that for every researcher, there's an equal and opposite researcher, right? So you have 20 ideas coming at you. How do you cull them out, and how do you actually make a difference together? So I'm reminded of a quote from yesterday's session. I don't know how many of you were there in the session by the chef. And he showed a quotation by Jane Goodall, which said, "What you do makes a difference, and you have to decide what kind of difference you want to make." So each and every person makes a difference. We have to decide how we go about it and how we tell that story. So with that, over to the panelists, and I'm really looking forward to hearing them.
Thank you, Aarti. Very well said. And again, just to say, each of us in this room has chosen a certain set of actions around a problem that has moved us in some way. And I think this is a really great moment, opportunity, and platform for us to bring our chosen paths together towards solving this wicked problem. Our panelists today will cover experiences from India, from Nepal, from Bangladesh, and from Pakistan. I'm only going to call them up one by one because they do have presentations and slides, and so some of them do anyway, so Aarti and I will step over to the side in just a moment. Our first panelist is Soumya Swaminathan, who should be no stranger to anyone. She is the chairperson of MS Swaminathan Research Foundation now, but formerly was WHO's chief scientist, playing a very critical role during the years of the pandemic. She's a pediatrician by training, recognized leader on TB and HIV, and for me, she is an absolute hidden, now not so hidden, Soumya nutrition champion. I have never heard her talk about any of the infectious disease challenges and other things that she has been working on for her life without recognizing the critical importance that nutrition plays. Soumya, over to you. You have about 10 minutes, and I'll maybe give you a 2-minute warning verbally in case you're going over time. Sorry you can't be here with us in person. We miss you.
Yes, sorry about that. Good morning, everyone. Hope you can hear me all right. And thank you very much, Aarti and Purnima, for this session and for inviting me to present. I'm going to try and share my slides. Just try, otherwise I'm going to ask someone in the room to help. Okay, here we go. All right now. Can you see?
Yes, we can see. You'll just need to go into presentation mode.
Yeah. Okay. All right. So a lot of what I'm going to say is basically going to be practical experience of MSSRF's work in different states over the years. This is something probably everyone knows about. I mean, this is from the latest NFHS data, but what is clear is that, we still have very high levels of both overt malnutrition in terms of underweight and stunting, and a growing percentage of overweight and obesity, particularly among women, and of course, anemia. And we also know that, we still have issues with breastfeeding, exclusive breastfeeding, and particularly with introduction of complementary foods. Only 11% of the 6 to 23-month-old children received an adequate quantity and quality of complementary foods, according to the NFHS 5. And again, both the midday meal scheme as well as the take-home rations that we give essentially are focused on providing calories and protein to some extent, and really don't provide all the micronutrients which are so important. Now, food systems is where we need to start from, because I think what ultimately ends up on our plate, as we all know, really depends on what we grow, and of course, whether it's accessible and affordable. And therefore, food-based approaches to improving nutrition are not only more sustainable, but also, I think, potentially also more acceptable to people. Now, of course, then that means we start with food and agriculture policies. And this is something that's been talked about for a long time by FAO and others. And yet, we have challenges in terms of, let's say, incentives or not having the right disincentives for farmers so that they will grow more diverse kind of foods and also engage in more environmentally sustainable practices for production, trade, and distribution. Now, this is a huge issue. It's not just in India, but globally. There is a lot of controversy. There are farmers' protests. There's been, governments have had challenges in moving forward, and yet this is absolutely critical. And we need to have this discussion, I think, with all the stakeholders in order to move in the direction of increasing the right incentives and decreasing the disincentives. Secondly, we need to frequently monitor or periodically monitor dietary consumption and access. And we have, of course, we used to have the NIN's in India survey on diets, which were done regularly, the urban and rural dietary surveys, which are no longer there. For the last 10 years, we haven't had them, but hopefully we can restart that, because that's extremely important. The household expenditure survey recently did show us tremendous increase in the consumption of processed and ready-to-eat foods, both in urban and rural areas. Then, of course, we need measures that will protect and empower the poor and women, in particular, whether these are women farmers or whether they are women who are, trying to feed their family nutritious food. So starting with women, empowering them, giving them the resources and tools, and targeting programs to them, developing capacity overall. I think nutrition awareness is extremely low. And of course, it's a multi-sectoral issue. Now, the farming systems for nutrition, and there's a quote from Professor Swaminathan, my father, who'd always talked about agricultural remedies to the nutritional maladies that are prevailing in an area. So he said, agriculture needs to be targeted, for example, an area with high iron deficiency. You need to look at what should be the components that you select in terms of crops, as well as farm animals and fish. So it's not only about crops, it's also animal husbandry and fish wherever possible. And when you try and do all of these together, particularly if they're landless and marginal farmers, then I think some of these other interventions, having more natural and biofortified fruits, in a nutrition garden, and encouraging households to have a homestead garden. So when this was tried out, as part of the Lanka project in two places, Koraput and Varda, this was a multi-country study that was done in Afghanistan, Bangladesh, and India. It showed, you can see that what is shown in red in the bars is the end line and the blue is the baseline. The consumption, cultivation on the top and the consumption of these variety of foods actually increased in both these districts. And since then, we've been promoting these nutrition gardens, whether they're in schools, Anganwadis. Of course, the Poshan Vatika scheme does exist, but how do you make it work? You need obviously the funding, you need the inputs, and you need someone who's going to care for that garden. There are now urban community nutrition gardens. So there is, I think we have a huge possibility to expand this through a variety of existing schemes. We need to strengthen them, but also promote in new places. This is another very good example, I think, from Odisha. Leadership shown by the Odisha government here really called the project on rice fallow management. And MSSRF is one of the NGOs that's partnering with the Odisha government on this, essentially basically increasing the production of pulses and in some cases millets, both to achieve self-sufficiency of pulses, but because many states still import them, making sure that pulse protein gets included in the diet of the local communities. It helps soil health through nitrogen fixation. And of course, it can improve incomes because this is fallow land and farmers are getting another crop, so they're increasing their income. So it's really a win-win kind of program. And the Odisha government has been rapidly expanding the acreage under cover. And we are also trying to now systematically study the impact on ecology, the impact on the economy, that is the livelihood of the farmers, and also the impact on nutrition. And if we can do all these three with one intervention, then there's no reason why we should not, really get massively scaled up. Another program going on in Odisha, this is through a CSR support, is called Samposhan. And there we're trying to improve household level dietary diversity through multiple interventions. So we're intervening with farmers here again to diversify the crops. We are supporting nutri-gardens at household levels, but also in Anganwadi centers and tribal residential schools, getting children to participate in the planting and taking care of the plants. And of course, behavior change communication and nutrition literacy, extremely important. And as part of that, mushroom cultivation, again by women's self-help groups, again a source of income and also a source of nutrition. The minor millets or the small millets, again, Odisha is one of the states which has a lot of varieties of millets. The government in general across India supports only the major millets, Jawar, Bajra and Ragi, for which, they get a minimum support price. But, we're losing all of these traditional varieties, the local land races, many of them are very rich in nutrients. So again, taking a 4C approach that was pioneered again by my father, conservation, cultivation, consumption, and commercialization. All four aspects so that the farmers benefit, but also their families get a better nutrition. So making sure that, we support these, particularly the tribal women who are mainly the cultivators and the conservers of these traditional millets, as well as traditional vegetables, fruits, all of these things which are now called neglected and underutilized species of cotton foods can actually be a rich source of nutrition for future generations. Same 4C approach when applied in a tribal area in Tamil Nadu called Kolli Hills. We know in India, for example, that the area under cultivation for millets has been falling significantly from the 1950s onwards. Now, the intervention started about 15 years ago here, and you can see that there's been an increase.
Soumya, I'm just going to give you a 2-minute warning. Thank you.
Cultivation of finger millets. And the interventions there is really through community seed banks, where the women actually manage the seeds and literally run it like a bank. And this has not only increased area under cultivation, but also increased household consumption. And they are also marketing value-added products. Similarly, integrated fish farming systems and post-harvest management. We're working with a number of fisher women's groups across the multiple states to add value actually to the post-harvest marketing of fish products. And then, of course, I'm not going to go into details, but extremely important really to undertake behavior change communication. A small UNICEF study done in partnership with UNICEF in Tamil Nadu showed, that adolescent girls particularly have a very bad diet. They consume more processed foods and high-fat, high-salt foods. So we really need to intervene in schools, not only through the midday meal scheme, but also through nutrition awareness and through building capacity for these kids. And in coastal states like Tamil Nadu, Odisha, adding fish, to the midday meal scheme could actually improve the dietary quality. So I just want to end with some of these, which there's nothing very, no rocket science here, but some of the policy recommendations, of course, using existing programs like ICDS, PDS, and the midday meal scheme, which India, by the way, has the largest in the world to improve nutritional security of the poorest households, linking farmers with local procurement. So, if you link the millet farmer, the vegetable farmer with the midday meal, I think, much more can be done there. Funding for the nutrition gardens, because it's one thing to announce that all of them should have a Poshan Vatika, but how do you actually operationalize it? Nutrition education, behavior change communication, particularly targeting adolescents. I think we can do a lot more on the food regulation space in terms of banning advertising of sugar-sweetened beverages in particular, but also regulating the advertising, making front-of-pack labeling compulsory, not allowing food companies to get away, with all sorts of claims. And then finally, more research, which of course is what you all are doing and promoting to study the effectiveness of these and other interventions with, I would say, a special focus on complementary feeding, because I think that's the window opportunity we have to reduce stunting in our part of the world. Thank you very much, Purnima and Aarti. Back to you.
Thank you so much, Soumya. I think MSSRF's role in building evidence and evidence-based models that then interface with the policy world are legendary. Let us now move to Nepal. I'd like to invite Pooja Pandey Rana to join us today. Pooja is a distinguished Nepali public health professional. She has over 20 years of experience. I think maybe I've known you for all 20 of those years, Pooja, and has really led, as chief of party of probably one of Nepal's very large integrated nutrition program. She has really led efforts to integrate nutrition across sectors. More importantly, I think, if I may, just personally, I know you as someone who's an absolutely big fan of connecting the dots between evidence and program implementation in particular, and we're really looking forward to hearing, your thoughts on that from the experiences with multi-sectoral programming in Nepal. Over to you. You have about 10 minutes, and Soira is in front here to help with timekeeping.
Great. Thank you so much, Purnima. Good morning, everyone. So I'm really honored to be speaking here today. I'm not a researcher, but as Purnima said, I'm a public health nutrition practitioner who really believes in data and scaling up evidence-based intervention at scale. And as such, practitioners like us, we really rely on researchers, the academic world, to really tell us what is the emerging evidence, what works, what doesn't work, and how much it costs to scale up these interventions. And I think this has worked very well in the health system world where, there was evidence, there was a set of intervention that if this was scaled up at, 80%, we would get impact. And as we now in Nepal are moving towards the food systems, we know that we have to bring these two worlds together. We are really sort of struggling and getting overwhelmed by just the different sort of drivers, different issues we need to tackle to make food systems work for nutrition, and especially for food systems to work for vulnerable groups. So my presentation will really focus on some of the food system realities in Nepal, what we know, what we don't know, and the support that we need from the research world to help us understand. As many of you know, Nepal, we have It's really unique in the sense that very remote. The geography sort of defines a lot of our food systems, sort of drivers, barriers. There's also, even though it's a small country, there's a lot of cultural diversity, and this also shapes a lot of the food system opportunities, but also the barriers. And you can see in the green that the farming zones are also very limited. Like I think many of the countries, and as we've heard in the last 2 days, the food system actors, they work in silos, it's fragmented, there's some disconnected policies, disconnected trade policies, and you can see that even though there are some good policies and plans, the reality on the ground is very different, and this is nothing new. We all have talked about how the cost of diets are very expensive, how rich and poor are getting their foods from the market. We need to do more about improving the dietary diversity. So Helen Keller just got awarded this big project in Nepal, and we're in the co-creation phase where we are really listening to some of the health system and food system actors to understand some of the challenges. And we've just completed this co-creation workshop in all the 7 provinces in Nepal, and it has been, being a public health professional where we know exactly what needed to be done, it has been extremely sort of overwhelming, and some of the key questions, basic questions, I think we were not able to answer when we were sort of designing, what sort of interventions are needed to improve food system in Nepal. So, we struggled in terms of like, where do we even start? Because some of the problems are so overwhelming. What solution exists so that we can take this program to scale? And what should we prioritize? Because there are so many problems. And to address this, I think we felt it requires focus, it requires more data, because there's very limited sort of data on what solutions sort of exist in terms of evidence. And we need to collaborate with diverse stakeholders, particularly the private sector. So I come here with like 3 asks for the academic world, for the researchers to help us sort of connect these dots, and so that we can do quality programming, we can scale up evidence-based interventions. So the first one is, can we please simplify these like really, really complex models? Because for people on the ground like me, it's extremely overwhelming. We feel like we're just so, we feel it's a very sort of Herculean task. We can't really do anything about it, because the framework talks about not just about consumer behaviors and preferences, it talks about trade policies, it talks about the different sort of environment drivers. So, and we also know that history has shown us that all these frameworks, plans, we need to like localize it, we need to make it more sort of actionable. So my first request is trying to look at these not just from a theory perspective, but also prioritizing actions for those that need the most. We understand that big system level thinking is important, but it leaves implementers like me very unsure of how do we act on the ground. So we need to put people in the center, like how, for example, I've given an example of this, the nutrition framework, the nutrition, UNICEF model where, there were families on the center, and then we kept going down, like what are the immediate like needs, what are the underlying factors, so something like that where we put people on the top, right? I think that would sort of really help us to connect with these frameworks. The second is we need more research on the solutions. What in the last 2 days, we've been talking about the same problems, right? Cost is the biggest barrier for healthy diets. We need to learn how to work with private sectors because unhealthy foods everywhere. food system is complex. And so instead of researching more on the obvious, we need more research on the solutions, on how do we reduce the cost of diet? What are the interventions that we need to be testing? If tax is the answer to reduce consumption of unhealthy food, we need to be doing more like political economic analysis to understand the how aspect of it, right? And I do encourage for researchers to building, so instead of doing a 5-year, 7-year long studies, evaluation, building these mixed methods, small iterative research within the program so we can learn as we go, we can test different solutions, and this will also help us to sort of scale up, implement on time, instead of waiting for the results to come. My third ask is to make the tools really simple. We've tried to look at the food environment tools. It is extremely complicated. Implementers like us do not have the luxury of time to do a 1-year study to come up with, again, like the same problems. Food is costly. People are consuming unhealthy foods. We know that. I think what we need to research more is how do we respond to that issue, and I think we need to really sort of work together on that. And I think my last slide is just in closing, even though food systems are complex, I don't think the solutions need to be. Solutions can be simple, and I think we need to be harder, work harder to really simplifying the frameworks and tools so that we can really implementers like me can adapt the tools in our context to identify local solutions. The tools need to also tell us, in these contexts, these are some of the food system interventions that you can do or that you should assess. So for example, in the mountains or the hills where food insecurity is really high, what are some of the intervention that the data evidence is there to show that we need to scale up? If we are talking about the Tarai Plains, where it's a food basket for Nepal, knowledge is not the issue, but they are buying food from the markets, they are consuming unhealthy foods. What are some of the food system interventions we need to be doing? So very much like driven by context, so that programmers like us can localize the solution. The second is investing more on local studies to understand how to reduce the cost of nutritious foods. I think it's going to be very critical. And finally, generating more evidence on how do we incentivize private sector engagement, because their motivation is very different than ours. So I think these are some of the top sort of topics I sort of learned in the last 2 days. Frankly, these are not new information. I think what will be new is really how do we connect the dot from what we know to the actions, like how do we go about addressing these problems. So thank you very much.
Thank you. Thank you so much, Pooja. That was absolutely brilliant and really forces us to think about how we go from problems to solutions. Let me now, we'll move to Bangladesh. Let me invite Dr. Ruhul Amin Talukdar. He's currently a senior policy advisor at IFPRI Bangladesh, but brings 33 years of experience in the Bangladeshi civil service, including roles at the secretary equivalent level. He has strong capabilities that connect policies, research, and program planning, has spent many, many years in his career working on issues related to agri-food systems transformation. He has a PhD in economics, a master's in development policy, and a bachelor's in engineering. I've had the privilege of seeing you across the table in policy settings over the many years in Bangladesh. We are really glad to have you with us at IFPRI to guide our own policy engagement and research, and look forward to hearing from you. Saura is keeping time in the front, and we'll give you warnings. Thank you. 10 minutes.
Thank you, co-chairs, ladies and gentlemen, and thank you for giving me the opportunity to say a few things based on my experience in the government for long 34 years. Let me begin with the complex food system that we talked about and heard during the last 2 days, and how it has been shaped when it comes to the policy domain of Bangladesh. In fact, since 2021, Bangladesh has been striving to formulate as well as implement the food system pathway document, cutting across the 5 priority action areas. And the country is trying to cut across the themes in terms of nourishing people, boosting nature-based solution, and the other, the resilience and the implementation modalities and all those things. And I think when you talk about research, in terms of connecting the dots, we need to align our thoughts on this very framework that the country is adhering to. In fact, as I said, I was in the government for long, 34 years. I like to tell the story that I saw. It's from my perspective, from my eyes, what I saw, that that Bangladesh was a least developed country, and in the 80s through 90s, it has sort of subsistence agriculture and supply-based policy. What we saw that in the 80s and 90s with the structural adjustment programs, that also influences the food policy of the country, food and agriculture policy of the country. And research and evidence has contributed a lot in the shaping of the policies in those days even. I remember the contribution of FAO and IFPRI, although I am in IFPRI now, but I am talking from the perspective of a government servant that I saw when I was working with the government. And in the food policy project, that was in the 80s, and then the food management research support project in the 90s. National Food Policy Capacity Strengthening Program by FAO, that is in the 2000s. And then the managing undernutrition challenges that is after 2007. All these policy projects have contributed a lot in shaping policies of the country over the years, over the last 50 years. And I must say that from the perspective of the subsistence agriculture and the supply-based policy to more gradually more towards the diversified agriculture and a diversified consumption pattern, how it can happen. I think the research has shown us the pathways of undertaking policies and programs in our country. Let me cite some examples of how research has influenced the policy in our country. You know that in 1998 and 1999, there was a flood, tremendous, serious flood in Bangladesh, and the country tackled its food security and nutrition effectively, I must say. And it was lauded by the global community that Bangladesh, even in disaster situation, how can they can tackle the country's food and nutrition security as well as make people to stay back, to cope with the situation. And in 1998, we saw that the private sector import has contributed in tackling the food security issues of the country. In the debate of cash and kind transfer, you know that when the structural adjustment program began in the 80s and it ran through the 80s and 90s and early 2000, there was a debate that you need not to have a food ministry as such. You need not to have a huge amount of stock because that is a loss to the country, loss to the nation. So you need to adopt cash transfer. That was an advocacy from a prescription from the global community at that time. And you know that with research, we had some backups to say, yes, whatever you are saying may be true for other countries, but we need to have some in-kind transfer as well. So we had research from BIDS, Bangladesh Institute of Development Studies. We have research backup from IFPRI. We had research backup from other prominent researchers in the country to say in favor of government interventions that it is needed. And that, in fact, we saw it in the following years, when we saw that the food and fuel crisis in 2006 and 2007, which ran up to 2009, and we saw this government of different LMICs. They have money in their pocket, but they were not able to buy food from abroad. So the policy of the government, in fact, was standing true, even who once talked against the government intervention in the food security domain. We also saw some research how it has contributed to different, the dietary guidelines. I recall when I was working in the food planning and monitoring unit of the Ministry of Food, I saw that a research like dietary pattern in the country, and that was conducted by BARDEM, a private and autonomous research as well as healthcare organization. And that has led to the formulation of the National Dietary Guideline 2014, which was eventually modified into 2020. So you can see how research can contribute to not only policy, but also programs. I recall some of the research that contributed to evolve of a program. Say, for example, the Food for Education program that was evolved into 1993 in the wake of a stoppage of a large program. And it ran through up to 2001. But again, that research by another organization that has caused to stop it. So research is very much important in the Bangladesh food security policy evolutions you can see. Now let me talk about some of my lessons that I learned from my experience in working in the government. In fact, for translating research into action, you require that the research has to complement the country-led initiative. If that can happen, you can see some practical aspect of it in terms of translating it into action. It needs to be demand-led. I recall that we asked for a research to BIDS for estimating the parameters for food planning, for PFDS planning, and that had yielded positive results in terms of supporting the policy planning in the ministry. It is required to onboard the local institutions when you take up research. Say, for example, if you can formulate a technical advisory committee comprising the representatives from the government, if you can pilot some of the research and you can demonstrate the results of it, that is TMRI, Transfer Modalities Research Initiative, that I saw. And if you have a very strong coordination mechanism across the ministries, something. It's not working. Okay. You can see that in Bangladesh, we have a sectoral coordination mechanism as well as intersectoral coordination mechanism as well. I'm not going to that detail. And that helps. If a country has a strong coordination mechanism in place, that helps in carry out the research as well as translating the research into actions through policy debate. So I stop here. Thank you.
Thank you so much, Ruhul Bhai. Really such a rich set of experiences of the back and forth and the walking and talking together of research and policy. Really appreciate that. We'll now move to Pakistan. It's my pleasure to invite Dr. Jay Das. He is an assistant director at the Institute for Global Health and Development and associate professor in the Department of Pediatrics and Child Health at the Aga Khan University in Karachi. He's country director of the Cochrane Collaboration. Many of you in nutrition would have seen Jay's name, probably associated with almost every Lancet series in global nutrition, because I know you and your team have contributed tremendously to the evidence synthesis efforts. Today we'll hear from you about Pakistan and about connecting dots between food systems and nutrition. Thanks.
Thank you. Thank you, Purnima, for this kind introduction, and for the organizers for setting up this beautiful conference. I think I missed the first day, but it has been a great discussion, deliberations the last day I attended. So the task that I have today is that to talk about evidence to policy and action. Some examples from Pakistan, but I'll most probably talk about the region as a whole, because I think most of these challenges are consistent across all the countries in this region. So it's not hidden that we are far away from the SDG target, especially the SDG target 2 of zero hunger, and still the consistent availability, accessibility, and affordability of nutritious food remains a big challenge. And we see that 1/3 of the people in this world, they don't have access to a healthy diet. And there is a great disparity between regions, between countries, and even within countries. So you would see a lot of, I would say, inequity when it comes to food accessibility, availability, nutrition. And Asia is one of the region in which you would see most of the people of the world, I think roughly half of the world food hunger is based in the region of Asia. And together with these existing challenges that we have had for decades, now the world is facing some challenges which weren't there, or maybe they weren't there to an extent what we are facing now. This includes factors of climate change, pandemics, conflict, migration, and most recently we have seen the rising cost of living. So all of these are adding up to the existing challenges that we already had, and this makes it even more challenging for people like us, people who are working in this sphere, to ensure how do we ensure that the food is there, food is made available, it is consumed, and it ultimately leads to better nutrition outcomes. So how do these new challenges are affecting the world of nutrition? We have seen that initially the projections for undernourished populations, the world was already off target, but this COVID-19 pandemic had set off these targets by even far, and had pushed even 160 million more people would be undernourished even by the year 2030. So you can see the long-lasting impacts of one pandemic that had even decade after that, and even would go beyond that. And out of these, I think the greater effect was felt in Asia, and more than 60 million more people would be undernourished by 2030. When you talk about climate change, again, climate change has far-reaching effects, and climate change affects this food system through a variety of challenges, variety of sectors. It affects agriculture, it affects irrigation, it affects biodiversity. It has direct effect and indirect effect on health and nutrition, and the climate hazards, which includes like floods, typhoons, storms, droughts, they also lead to, I had said, direct and indirect health effects, and also affects the infrastructure, which ultimately has an impact on your health and nutrition. So these climate change hazards, whether it's increasing heat, altered rainfall, storms, typhoons, wildfires, all of these are having a greater impact on the already existing challenges that we had in the world of food systems and nutrition. Again, unfortunately, what we see, women bear the brunt of all of this, what's happening around us. And we see, just because of this climate change, 160 million more women would be pushed into poverty, and around 240 million people, more women, would be pushed into food insecurity by the year 2050. This is a graph showing what can be achieved and how climate change is affecting this trajectory. And even if we see that the world is already not on track, if we go with the current trend, but with the climate change hazards that we are posing, this is going to even give us greater challenges. And so this, the purpose of showing this is that I need to just reaffirm that we need to work harder than what we have been doing, and all of the sectors need to come together to find ways in which we can tackle these increasing challenges that the world is facing, and especially the region that we live in. What's the landscape in South Asia? Again, remains far from what we desired. And some of the indicators that I like to show is that for stunting, you see out of these 9 countries, only 3 are on target. For wasting, we don't see any of the countries which are on target. Same goes for anemia, low birth weight, exclusive breastfeeding. 5 countries you see are on target. So for most of these key nutrition indicators, we see that most of the countries are off target. And one example that I like to quote here is for Pakistan. You would see the progress, or more correctly, I would like to say a lack of progress over the last 5-6 decades, because stunting is a core indicator for assessing the chronic nutrition, and even has been stated to be associated with national development. And you see that the prevalence of under 5 stunting is hovering around the same point for the last 5-6 decades. And when you see for stunting, you see there has been an increase. And this increase has been because I said that on top of the existing challenges, the current dynamics that we are living in is adding to those. So what is required? So actually, there's a need for a connection between food systems, contextual factors, intervention, policy, implementation. All of this has to be synced if we need to have a far-reaching or a sustainable impact. When it comes to policies, we see mostly in South Asian countries, whether it's policy regarding balanced diet, policy for sugar-sweetened beverages, policies for salt iodization, or saturated fatty acids, or marketing, we see most of the countries still lack a policy. We're still far from implementation because most of these countries still don't have a comprehensive policy regarding these key nutrition strategies. It comes to funding because nothing could be achieved if you don't have adequate funding for those. And what we see is that even countries in these regions like Pakistan and Afghanistan are far behind from other countries in the regions. And even most of the funding in these 2 countries is coming from a donor. So a high reliance on donor funding, which again shows that there's a lack of sustainability in the effort. So a simple framework would have been that we cater to the affordability, availability, accessibility food, cater to the health effects, and we can have some impact on nutrition. But as I mentioned, with this current dynamics of climate change, escalating food prices, conflict, migration, apart from what we have been doing, I think there needs to be a greater emphasis on improving the resilience and adaptability of the communities, because doing whatever we have been doing for decades wouldn't take us to where we want to be. I think we have to find ways to enhance the resilience and adaptabilities of the communities, because these challenges that we are facing would not have any answers in the near future. So we have to be resilient, find ways to adapt till we find solutions to these increasing challenges. There could be many areas which could be taken, including from food systems, coverage, social protection, investments, safe and supportive environment, but a cohesive approach would be required. So what works and what needs to be done? We have known this for years that we have to have a multi-sectoral approach if we have to make an impact in nutrition, whether it's health sector, whether it's sectors beyond health, like women empowerment, education, water sanitation and hygiene, poverty, social protection. So all of these sectors have to come together to make a wholesome change. And some key priorities that I would like to highlight is that we need to have a sustainable, resilient food systems for healthy diets, an aligned health system which would provide universal coverage of essential nutrition and non-nutrition interventions. More importantly, there needs to be a social protection system within these countries, especially to the most vulnerable populations, and more importantly, during acute crisis. A trade and investment for improved nutrition should be a focus, and we should find ways for international trade and sustainable investments. A safe and supportive environment for nutrition at all ages, and more importantly, I think a greater focus and emphasis is required on strengthening the governance and accountability at all levels. So with this, I'd like to end my presentation, and thank you all.
Thank you, Jay. Thank you for that. When we come back in Q&A, I think we'd be quite interested to see also how some of these things are translating in context in Pakistan. So we'll really look forward to hearing more from you on that later too. Let me now invite Geeta Sethi, who's advisor and global lead for food systems at the World Bank. She's a lead architect of the World Bank's Food Systems Transformation Agenda, a food system, yes? And really manages very large portfolios at the World Bank. And I think in shaping the thinking on how the food systems transformation agenda at the World Bank can support the financing and the necessary actions to take us forward and really connect dots. I consider you a nutrition champion as well, Geeta. Welcome to Delivering for Nutrition. We're glad to have you here. You also have about 10 minutes, and Saira will keep time for you.
Thank you. Thank you so much. A real honor and a pleasure to be here. And thank you for inviting the World Bank for this session. It's been delightful to be part of this deliberation the past few days. Particularly what's been very strong has been the fact that there's a clear recognition that a lot of outcomes you're after on healthy, sustainable diets and nutrition cannot be dealt just with in addressing nutrition as a silo. It is really interconnected and it's core to development. And today, in terms of the policy to action, I want to zoom out a little bit. There's been a lot of conversations in terms of research, what needs to happen. We heard about the different countries. But I want to zoom out and talk a little bit on the financing side, because I think it's core to what we are seeing and why we say food systems today is unfit on any aspect, whether it's within the planetary boundaries or it's about healthy, sustainable diets and human capital. And let me lay out a few of these financing areas that I think we as a community need to ask more of, and there really needs to be collective leadership around this. First and foremost is the public finance towards food systems or agriculture and food systems, and it hovers around 800 billion a year. This is the financing or the subsidies, however you want to call it, has a huge impact in some of the things we've been hearing about, whether it's about the affordability of more nutritious foods, whether it's about the emissions in terms of the food systems generating and thereby then making it much harder for countries to adapt. And this 800 billion that we truly believe needs to be repurposed, 35 cents to every dollar goes to the farmer. So when you talk about a family of 5 trying to afford a healthy diet within the food and agriculture sector, it's hard. But more importantly, I think what this financing is just earmarked largely to 3 or 4 staples, including sugar and grains. So there's a huge disbalance between subsidized commodities versus non-subsidized. And when one looks at the diversity of diets needed and the affordability part, it has direct impact. So that's one big ask for us collectively. A second area that I think is very important for us to come collectively on, and some of the policymakers here were saying what are the practical ways forward, is climate finance. And this, I will argue as well, has a huge implications in our sector in terms of the outcomes we're after on a healthy diet. Today, climate finance, give or take, is about $660 billion a year. The agriculture and the food sector gets about 4%, so that's about $25 billion a year. That's one problem. If the emissions from the sector are 30%, one can argue that we are looking for scalable financing sources. But the other argument that I wanted to put here is the breakup between mitigation and the adaptation. And we all know that to adapt, to be resilient, food is needed. Quality of diets is very important. And this breakup is about 96% is towards mitigation and only 4% that goes into adaptation. So I think it's very, very, very important that this ratio changes, and changes because we want this outcome on healthy, sustainable diets and outcomes. The third source of financing that we haven't seen many from the private sector is private sector financing to food systems, which is north of $2 trillion. Now, why is this important? And we heard about what's happening in terms of the products, processed products, and so on and so forth that's being put out. These companies, Benchmarking Alliance has done a research looking at I think the top 250 corporates in terms of food sector. And the results are very sobering because they have a huge amount of resources going into research, but that research is trying to figure out our taste in terms of the ratios needed between trans fatty, sugars, etc., to really make our children go out and buy more of those crisps or chips or whatever they're called. So I think there is a huge need to get some kind of a consciousness into the private sector and the food. And they set their sustainability targets, even though they have all aligned to it, they're dismally off from whichever lens we think of. So those are three. I want to put two more because we've heard about social protection here, and we've talked about a lot on the affordability, as I mentioned. Fourth is our poverty lines. In a large number of countries, the poverty lines, the basket of goods that people are buying, and therefore that's defining these poverty lines, is largely caloric based. It's not nutrition sensitive at all. So there is a need now in different countries to really have a hard look in terms of how these poverty lines are being defined. The question then is, how do we manage the disconnect between what we are asking people to eat and how they afford it? And here is the social protection programs. You all know numbers for the different countries, but globally this is about $1 trillion. And what I can assure you is that these social protection or income support programs are not nutrition sensitive at all. So there is a big room here to get some of these sources of financing much more aligned in terms of what we're after on our outcomes. As you already have heard, another source of financing I want to put on the table, it's just being, the conversations have just started, is the loss and damage fund. And the idea here is that there is, with the floods, the droughts, and so on and so forth, there are permanent losses of incomes, of livelihoods, and therefore, how can families be supported when these events happen? Now, it's very important that agriculture, again, countries are wanting to know what they should do practically, that agriculture and food is represented here, and it's not just, it doesn't become a conversation out there without agriculture at the table. So it's starting, and we are pushing on this, but we need to do this as a collective, as a group here. My final point in terms of the financing is, and I think you must have all heard that now, it's mostly there's a perfect correlation by countries that are highly indebted are also highly food and nutrition insecure. So the big agenda that's been put on the table now is debt swaps. And the argument we have is that if debt for climate or debt for environment is on the table, thank you, then debt for food makes a lot more sense, because the food and nutrition insecurity that arises out of this highly indebted countries, which are also facing liquidity crisis now, affects children the most, women and children. And this is a permanency argument that this causes, we saw the numbers on wasting and stunting. There's a permanent human capital loss here. And therefore, debt for food needs to be on the table with very clear criterion in terms of what are the healthy outcomes that we are after. And this is, again, something that we as a collective, we as policymakers need to make sure that it is very much on the table. So with that, let me stop. I think I'm almost out of time, but once again, a huge applause and thank you for making this conversation so alive and really pushing at it systematically, persuasively, and ambitiously.
Thank you so much, Geeta. Please do come and take a seat. Let me invite all the panelists to please come up and take a seat. I think we'll open for questions. So if you have questions, please go to the mics.
Thank you. That was a very exciting discussion. And now we're open for questions. You know the drill. And I see some people standing here. We'll take 3 questions to start with. And please tell who you are addressing it to.
Good morning and greetings, everyone. And thank all the panelists for evidence-based discussions, how policy can be in the actions. And I think I am Joinal Abidin from IFPRI, Dhaka, Bangladesh. From all the presentations, and previously I learned, the first presentation, it was done by Somaya from India. I'm not sure whether she is still online. So I see previous presentation, adolescents actually are very much sensitive to expose with the advertisement, and that is mostly leading to the unhealthy diets. And her presentations, recommendation come up to ban such type of advertising to save the future generations from the unhealthy diet. And also another policy recommendation come up to labeling the nutrition, labeling the all food packages. So that issues actually we face in Bangladesh. We have a policy, but not actionable. I raised several policy discussion in the country. And also I see some food pack, there is labeling, but this is not readable by many people. Font is very small, and most are in English. Language are not localized. I see similar type of things even other countries. So question is that how it can be actually that policy recommendation can be actions labeled to implement so people can be benefited. Thank you so much.
Thank you. And also a request to keep your questions brief so that we can have more questions.
Okay, I represent the Scaling Up Nutrition People's Forum in Sri Lanka. And I just would like your opinion on the following. And I call this connecting the dots on a sharper outline from connecting the dots across systems. We have seen many of the presentations today which are very interesting, but it's like, old wine in new bottles for most of it, except perhaps one or two. So, in order to make this sharper, I would like to ask the panel, what do you think? Profiling each farmer with their capability to actually sharpen those interventions that you spoke about. Do we really know? FAO, of course, has a very ambitious interoperability program at the moment that is being designed. Sharp connection to sharp and accurate connections to markets, which we are really struggling with. 3, hotspot identification and list of vulnerable, nutritionally at-risk households to be targeted. A child vulnerability scorecard to be scored at birth so that we know that they don't really, or preventive action can be taken. In fact, I have had some discussions with the World Bank many a time. The 5th one, selecting low-hanging fruit from the multi-sector action plans on nutrition. And at this moment, the Scaling Up Nutrition People's Forum has presented a campaign to the government with 5 key asks. So the entire multi-sector action planning we may not be resourced, but we have identified key actions. So what do you think of that? That's my question.
Thank you. Any particular speaker you'd like to respond to?
I think any speaker who would like to.
Okay. Can we have the next question, please?
Hello, everyone. I'm Drishti Sharma from IRV New Delhi, and my question is for the entire panel. As funders and policymakers commissioning and using the research, as well as researchers and implementers who are creating this evidence and applying it in the field, I wanted to know, how does today morning's discussion make each one of you think differently in strengthening the impact of the evidence that we're creating? Thank you.
Thank you. So we have questions which are wide-ranging and addressed to all panelists. I'm not sure if Soumya ji is available online. We'll take you in the next round. Whether Soumya ji is present online, I'm not sure. But anyhow, may I request the panelists to choose the questions and respond to them. It's entirely up to you. Yes, please.
Thank you. I think all the questions are very important when it comes to translating research into action and connecting the dots. On the first issue that was raised by Mr. Joynal, I think our panelist, in fact, he raised a question to the first panelist, and I will be happy to respond on that in the first place. In fact, you require enforcement when you talked about the issue of labeling, you talked about the issue of banning advertisements. In fact, these are part of a country's legislative structure in the food system domain. And it is required to enforce them. And in fact, these legislative issues are based on evidence. It's not that it came from wish list. So it is the country's responsibility to enforce those. On the issue of, on the 5 points that was raised, one of the participants, I think in terms of hotspots identification, I think that is a priority in the face of climate change impacts on the food system. And that is definitely should be a priority and should be pursued. Profiling each farmer, I think that is part of the solution. In Bangladesh, we have been trying to profile the farmers. In fact, at this point of time, there is a program going with the support of World Bank to have to profile farmers and provide them with smart cards. That is good. And about the low-hanging foods, I think, that is reachable, but might not be a solution for a healthy diet. Thank you.
Thank you. We also have Soumya ji online. If she's present, may I ask her to respond to the first question on adolescents? Okay, I think, did we lose the connection?
Yes, thank
Okay,
you.
okay.
I mean, I think that the adolescent issue is a very important one, and it's not very easy either, because there are multiple drivers and determinants, of what they eat. And so it requires an interdisciplinary approach. I think it definitely requires more evidence building into what sort of interventions are effective. Adolescents these days, I think, respond a lot to peer group pressures and behavior, as well as probably are influenced to a large extent by social media, but also by advertising, because they look at role models. And if you have celebrities, sports champions, film stars and others advertising for certain products, it does have a very big influence. But I think it's such an important issue that we need to pay more attention to it. And we can also use technology now, of course. And so one of the things that we've been thinking about with a few partners, including IFPRI, is how do we use artificial intelligence, you can use AI in many different ways, but how do we use it perhaps to create behavioral nudges, especially for those who use, who are connected and who are online and who have smartphones, based on what they're actually eating and consuming. Can you have a behavioral nudge that will both a positive and a negative nudge at times to try and change behavior? But again, these are hypotheses which need to be tested. But I think adolescent health, particularly girls' adolescent health, can set the stage for future generations as well. So it's not only about her, but she's also potentially a future mother. So I think it's extremely.
Thank you. I think we are losing the connections. So I'll quickly move on to the other panelists and ask them to respond to the 3 questions very quickly, if you'd like to. Pooja, I can see you. Yeah.
Maybe, so one of the things that in terms of consumption of unhealthy snacks, we all know that it's cheap, right? So I'm a mother and it's difficult to cook, for 4 meals a day. And, and just to put things in perspective, the price of 1 egg in Nepal is 25 rupees. You can buy 5-6 packets of noodles, which is just like, you can get it next door, right? So when you're talking about, it's not just about, everyone knows that the noodles are unhealthy. People who are eating it too, but the drivers are very different. We are, some of us are addicted to it, some, it's taste, all that. So in terms of raising consumers' awareness on labeling, I think it's also like we talked about nudges. One of the things that we will be testing in Nepal is some sort of traffic light, which I understand in Sri Lanka you've done that before, where red is extremely sort of unhealthy, high fat, high sugar. So let's see how that works. But some sort of like, a color-coded or some sort of symbol, so that when you go, instead of choosing the unhealthiest packet of noodles, they choose a better version, right? So that's one. The other is, I think someone gave a list of a lot of interventions that, in terms of implementation, the scorecard, all that. I think it's your context, your programming context, who you are working, who is your target group, sort of drives those sort of intervention, whether it's a scorecard or your low-hanging fruits. But I think it's also, we have to accept as a nutrition community that the problems are getting more and more complex, and the intervention, no one intervention is going to solve all the problems. And so we just have to accept the gray area, that there is no like one size fit all. And in a programming world, it becomes complex because there are so many contexts, so many groups that you have to work, and all of them needs like different set of interventions, right? So embrace that, the messiness.
Wicked problems, which is why you need to connect all the dots.
Right, so I'll just like to add to what others have added. I agree that the solutions are the same, but I think there's need to have some more granular approach both, as mentioned earlier, in terms of identifying the vulnerable populations and targets, but also to make these solutions more contextualized. And because we see, I would say for Pakistan, even within a country like Pakistan, there's so much diversity in terms of the socio-cultural, in terms of the geography. So there's a lot of diversity. And even a one solution fits all would not be applicable for one country, any one country in this region. So I think we have to find some context specific. We have to make some granular suggestions, and that could vary between various regions of our country depending on the needs. And I wouldn't differ, and I would just re-emphasize and underscore that we have to identify the most vulnerable populations, target them first if we want to achieve a longer term impact. So that's my take on this question.
Yeah.
Thank you.
Absolutely. Geeta ji, would you like to say anything? No? Okay. So we can take another round of questions. I can see there's some online questions there. And the lady there, please.
I'm Dr. Reena Ranipal. I'm from Bangladesh, and I work for National Heart Foundation of Bangladesh. So National Heart Foundation is very much into policy advocacy and working on, worked with trans fatty acid regulation, and we are also working with salt reduction strategies and other things. So first of all, I would like to thank Geeta ji and Pooja ji for highlighting the importance of role of businesses and industries in terms of connecting these the dots, and how someone need to work with them so that there are some sense in what they're doing. So I will thank, but my question is for Geeta ji, and also Geeta and Pooja ji, both of you can take it, is that many times what happens is that we go for the policy or regulations. After that is done, the implementation part, because I'm particularly here talking about the trans fatty acid regulation. National Heart Foundation worked with GAI and different ministries and Bangladesh Food Safety Authorities for the trans fatty acid regulations. But then what about the implementation of these? You know, there are some challenges, and they need some, the industries and the Food Safety Authority, they will need some ongoing motivation and support, external support. But there is a resource gap in there and funding gap. So how do you want to address that? Thank you.
We are running out of time. Can I please request very short questions, just one-liners if possible?
These are two online questions. One is for Pooja, and the other one is open, so anybody can answer. For Pooja, the question is, kitchen garden has been promoted or being practiced in Nepal by HKI and other institutions. Has there been any study evidence of its impact on the nutrition, especially in rural context of Nepal? So that's for Pooja. And the general question is, it becomes clear that unaffordability to healthy diets and the increased desirability of ultra-processed food remain critical challenge. How can we effectively engage private sector stakeholders to make healthy foods more available and affordable while reducing the appeal of ultra-processed non-nutrition options? Any experiences or lessons learned working with the private sector?
One line, please.
Thank you. Thank you. Given the limited time frame, I want to have only two clear specific questions. Very interesting presentation.
One question.
What could be the pathways for change in terms of translating policies to practice, and from practice to policy? Thank you.
Thank you.
Soira Gune from IFPRI. I had one quick question about, so we know that adolescent females are one of the most vulnerable population groups to climate change. I wanted to ask, how do we go about reducing this vulnerability, given that adolescent females' health and nutrition is not very well captured in a lot of these population health surveys? Yeah.
Thank you. So that brings me to the panelists. Geeta, would you like to go first?
Sure.
Thank you very much. I'll address the question on the private sector. I think your point is well taken, but it's in terms of the enforcement part. I think what experience has taught us, there's no point doing a knee-jerk reaction and coming up with new policies that do not have an monitoring or enforcement ability. So one almost has to think through the entire chain before coming up with otherwise it's just giving a good good intention a bad name. But I want to also just, if I may, just go back on the affordability side that Pooja ji talked about in terms of the convenience factor. So why are noodles cheap? I want to go back to the public support or the subsidies. Noodles are cheap because the ingredients have been subsidized. Sugar is the most subsidized commodity. Wheat, rice. So if these are the commodities, automatically, I mean, private sector is there to make money. So why not? They will use these ingredients and produce what you're demanding. And don't underestimate us as consumers. We are spending close to 12 to 15 trillion ourselves. So there is an entire demand side that we can influence. We have the ability to act. Thanks.
Yeah. So I'll just be very brief. There's one suggestion on what should be the framework or pathway from policy to action. And I think one key component is that we should have engagement of the multiple stakeholders during framing those policies. And more importantly, the community itself, the people for whom these policies are, I think they should be actively engaged rather than just being a mere recipient of most of these policies and programs. So a multi-stakeholder collaboration at the very onset, I think, could easen up these actions at the ground. And secondly, a question on adolescent. I think this is something which is very close to my heart and to many people, because I think working on the adolescents is something which is going to give us those long sustained effects that we are seeking for. And if we need to work on the adolescent health, I think we need to empower them as a whole. And a key component empowering them would be to providing them some education, not education, but quality education, equipping them so that they can be an active members of the society. And once they are productive in work and arranging their own or managing their own finances, I think all of those could be achieved. So I think focusing on the early career, on their education and development should be the key component. Thank you.
Thank you. There was a specific question on Nepal.
So regarding the evaluation of homestead food production, there has been multiple evaluation done, not just in Nepal, but other countries as well. This approach hasn't sort of led to impact on the nutritional status, but in Nepal we have seen huge improvement in dietary diversity, both of women and children, also in terms of their income. And it's not just kitchen garden, it's homestead, meaning it's more than just growing vegetables, it's poultry, it's goats. We are now sort of expanding. So Helen Keller now is thinking beyond just homestead, but a local sort of agri-systems where there are different actors, private sectors, vendors. So we've sort of refined this model further as well. But there is impact on dietary diversity and income, household income in Nepal.
Thank you. So that brings us to the end of this session, and we are behind time by 5 minutes, so I'll wrap up very quickly. I think this has been a very fascinating panel. It brought together all the different strands of thought. You know, this morning I was talking to a lady from Africa, and she said, I can't make out one person who is from which country because you all look alike. And actually, it's a fact. All of us have the same shared history. We look alike. We eat almost the same kind of stuff, and our countries are almost similar in our indicators. There's so much to learn from each other, and this panel brought it all together beautifully. To my mind, what stuck out most is that we know the what. It comes out from the evidence and from the research. What is needed even more is the how of it. How do we actually walk the talk? Because when we are talking delivery, the process is very important. So the how would also answer the question of who and when and at what cost. And that is what we mean when we say we need to connect the dots. Otherwise, you remember that whack-a-mole. You hit one thing, the other thing pops up. So you need to look at it holistically. You need to understand all the implications. And as you very rightly said, we need to understand and put the person at the center, understand what impacts them. They're an agriculturist, it's a woman, it's a beneficiary of a social security, but it's one person. So keeping that person at the center, if we can design our policy and our actions and learn from each other, I think we will be able to connect those dots. Purnima, over to you for last words of wisdom.
I want to say thank you as well to the panel. I think all of you challenged us tremendously. You know, I speak from the side of the research community that's really thinking about what we can do to help solve these wicked problems or point to the direction of solving wicked problems. We take very seriously both the praise that you've offered to the research community, but also the challenges, not just in terms of what research topics strike you as being important as we look to the future, but also some of the things we need to consider in terms of how we do that research, the pace of the research, the connectedness of it with the people trying to make decisions. I will say to you that this is something we think about a lot. We know that good quality work takes time. We also think it's very dangerous to move towards impact or towards solutions without knowing whether they work. And sometimes it just takes that time. You know, it's heartening to, for example, see that we've all now accepted that social protection should have coupled nutrition education. That single one line, the realization that we all agree on that, comes on the back of 10 years of research in perhaps 10 different contexts that have all pointed the evidence in that direction. So sometimes it takes time. Our challenge is now how to accelerate both the doing of the research, the financing of the actions, and then the implementation also with quality, right? The implementation also needs as much quality. So I thank you all so much. Thank you to the audience for great questions, and thank you, Aarti, for being a wonderful co-chair. Thanks.
Can we all come in front for the group photo? Thank you so much, Aarti ji and Purnima. Thank you so much, all the panelists. We are going for a short tea break. After the tea break, we will have the first thematic session for this day. In this room, Lotus Ballroom, we'll be talking about food access constraints and facilitators. And in the adjacent room, Saffron and Ginger, we will be talking about addressing nutrition challenges in vulnerable populations. We will start at 11 a.m. sharp, so please be in the rooms that you are interested in. After the thematic sessions, the first thematic session is over, we'll go for lunch and come back for the last thematic session of the conference. In room Lotus Ballroom, we'll have nutrition knowledge and access to information. And in Saffron and Ginger, we'll have digital innovations across food and health systems. So looking forward to all of you. Please be back by 11 a.m. We'll start the session at 11 a.m.